Okay, today we will discuss about the lymphomas. Lymphomas is nothing but the one type of cancer which is related to the blood. It is also called as one type of blood cancer. Where this lymphoma majorly affecting area will be your lymphocytes. Here this condition is these lymphomas are majorly categorized into two types. First we will discuss that the lymphoma is a condition where this particular is a blood cancer related to the cancer which is related to blood. It is a blood cancer where the affected cells are the lymphocytes. Lymphocytes majorly useful for the carrying of lymph is a fluid which is responsible for the carrying of waste materials in the body. Here in case of lymphomas majorly categorized into two types: Hodgkin's lymphoma. Another one is the non-Hodgkin's lymphomas. Hodgkin's lymphomas and non-Hodgkin's lymphomas. Major categories of lymphomas. Lymphoma is nothing but a blood cancer. This is related to the lymphocytes where there is a abnormal growth of blood lymphocytes will be occurs due to this. How this will be increased means it can be increased by increasing the WBC, white blood cells or white blood corpuscles. White blood cells or white blood corpuscles will be increased in case of your lymphomas. Either it may be Hodgkin's or it may be a non-Hodgkin's lymphoma. Hodgkin's lymphoma as well as non-Hodgkin's lymphoma. It is a lymphomas. Majorly it is a one type of cancer which will be related to the blood. How it will be related means it is affects your lymphocytes. Lymphocytes means these lymphocytes increasing will be occur due to the increase in this particular WBC count, abnormal increase in the WBC count of that particular person. Either it may be Hodgkin's type or non-Hodgkin's type of lymphoma. Whereas in case of Hodgkin's type of lymphoma, what will be happen? We will discuss individually. What are the differences between your Hodgkin's lymphoma as well as lymphoma, non-Hodgkin's lymphoma? Hodgkin's lymphoma, and non-Hodgkin's lymphoma. Here in case of Hodgkin's lymphoma, it is a very rare condition. Rarely there is a 2.2% of 2.2 persons in a 1 lakh people. 1 lakh people, if the particular Hodgkin's will be affected 2.2 persons per 1 lakh of men. Okay, here in case of Hodgkin's lymphoma, this will be a rare condition. What is the major difference between Hodgkin's lymphoma and non-Hodgkin's lymphoma is that it is a rare condition where it will be affected 2.2 persons in 1 lakh people. It may be affect 2.2 persons in case of man, whereas in case of women 3.2 person in case of 1 lakh people. Here in case of non-Hodgkin's lymphoma, it can be occurred in case of India, and 1 million people every year they are affecting with this particular condition. That is non-Hodgkin's lymphoma. Why this is called as Hodgkin's lymphoma means this was first discovered by Hodgkin's in 1832. That's why it is called as Hodgkin's lymphoma. Why we are calling it as a Hodgkin's lymphoma means it was discovered by Hodgkin's, a scientist, in 1832. What are the major differences between these two are? Here in case of Hodgkin's, majorly related to the superficial layer of the skin as well as neck region as well as superficial layers of the skin. There will be the development of nodules. It is specifically related to your neck region as well as superficial layer of skin. If this particular is affected, this condition is affected. Non-Hodgkin's lymphoma, it is entire circulation it will be affects. Entire circulation it will be affected. It is not a specific area. There is no specificity towards the nodules. There may be the formation of nodules or not in case of non-Hodgkin's. In case of Hodgkin's, there is a formation of nodules. This is called as nodule predominant Hodgkin's lymphoma. Nodules predominant Hodgkin's lymphoma. Whereas in case of non-Hodgkin's lymphoma, means this is also one type of cancer where it will be occurs due to the increased number of lymphocytes, which is related to the WBC cells, but here this will be entire circulation is affected in case of non-Hodgkin's lymphoma, whereas Hodgkin's lymphoma it is affected only at the neck region and superficial layer of the body. Here this particular condition we can be diagnosed by X-rays. How we can be diagnose these conditions? Here we can be seen. How we can see? Here there is an appearance of nodules, and the nodules means lymph. There may be the accumulation of lymph at that particular area of neck region that may develop your nodules. That is called as lymph nodules, which will be occurs in case of neck region. That is called as Hodgkin's lymphoma. It will be affect apart from the neck and superficial skin layer that we call as non-Hodgkin's lymphoma condition. Here in case of signs and symptoms, majorly there may be the chance of fever. Both the conditions there may be the chance of fever, and in case of Hodgkin's there is a nodular appearance that may not be appear in case of lymphoma. Lymphoma condition we can see this particular appearance of nodules. Here in case of non-Hodgkin's we can come across this particular nodular as well as fever condition as well as fatigue. Both the conditions we can fever and fatigue we can see it in case of Hodgkin's as well as lymphoma condition. Whereas in case of nodular only we can see in case of Hodgkin's, we can't see in case of lymphoma condition. Here in case of signs and symptoms, majorly weight loss. Weight loss also major important thing in case of both unintended weight loss occurs in case of lymphoma as well as Hodgkin's lymphoma. And a diagnostic stage, majorly we can use the X-ray as well as we can use this particular biopsy of nodules. Hodgkin's means we can go for the biopsy of nodules, whereas in case of lymphoma we can go for the complete blood count test. CT scan, X-ray, chest X-ray, major chest X-ray, CT scan, CBC is a major test for this particular condition, Hodgkin's as well as lymphomas. Complete blood count means here there is a changes in this particular white blood cell count. White blood cell count is increased. That's why we are seeing this. We have to analyze the how much white blood cells are present in this particular person. Either he may suffer, that particular person may suffer with the Hodgkin's or it may be a lymphoma condition. There is an increase in the CBC as well as CT scan as well as chest X-ray. In case of lymph biopsy, we have to see the lymph biopsy. We have to see in case of both the conditions. And majorly this particular Hodgkin's is occurred due to the mutations in the DNA. These mutations may occur due to the EB virus, which may causes the changes in this particular WBC. The DNA which is responsible sudden changes in the DNA which is responsible for the production of WBC. That virus is EB virus that will be causes your Hodgkin's. Whereas in case of lymphomas, normally it can be occurs due to the sedentary lifestyle as well as usage of the drugs or usage of the surgery that will be causing these particular conditions. And in case of treatment, signs, what are the signs we can come across? Fever, appearance of nodules in case. Now we will discuss about the treatment of lymphomas, both Hodgkin's lymphomas as well as in case of non-Hodgkin's lymphomas. Hodgkin's lymphomas, majorly we can use the cancer chemotherapeutic agents Majorly we can use the cytotoxic agents. Cytotoxic majorly which will give the abnormal growth of unwanted cells. Abnormal growth of unwanted cells. And then next one is radiotherapy. For blasting that particular, by using gamma radiation, we can blast that particular nodules which will be developed at your neck region, nodules which will be developed at the neck region of that particular Hodgkin's lymphoma suffering patient. Third one is surgical procedures we can be used for this particular condition for Hodgkin's lymphoma. Whereas non-Hodgkin's lymphoma, we can go for various therapies are there. Stem cell therapy means, whereas in case of pluripotent stem cells which are helpful for the synthesis of RBC, WBC in the body, that can be transplanted in case of stem cell therapy, as well chemotherapy agents as usual we can use, and radiotherapy means we can use whenever there is any unwanted growth occurs with this particular WBC, that can be arrested, and targeted therapy based on the organ which may affect that, in that condition we can use this particular condition. And apart from this, anti-helminthic agents like cannabinoids also used for the treatment of non-Hodgkin's lymphoma. The Hodgkin's lymphoma, we can use the chemotherapeutic agents, radiation therapy and surgery. Whereas in case of non-Hodgkin's lymphoma, stem cell therapy, chemotherapeutic agents, radiation therapy and target therapy, as well as anti-helminthic agents. For a particular condition, a non-Hodgkin's lymphoma, where it will be occur in case of your GIT, lymphoma and GIT, that time we can use the anti-helminthic agents. Majorly cannabinoids can be used for this particular condition. This is for the treatment of lymphomas. First one is a Hodgkin's lymphoma and non-Hodgkin's lymphoma. We have discussed clearly about the Hodgkin's as well as non-Hodgkin's lymphoma. Whereas in case of Hodgkin's lymphoma, majorly affects below 40 years age. Whereas non-Hodgkin's lymphoma, it can be affects above 60 years. This is a basic difference. What is the basic difference? Hodgkin's and non-Hodgkin's. Hodgkin's is developed at your rare condition. It is a regular condition. In case of he is 2.2 persons per 1 lakh, where 3.2 per 1 lakh men as well as women respectively. Whereas it can be 1 million people are affected irrespective of gender, they are affecting in this condition. And below 40 years this particular Hodgkin's lymphoma is developed, whereas above 60 years the non-Hodgkin's lymphoma is developing. And in this particular Hodgkin's lymphoma, we can use the treatment cancer chemotherapeutic agent, radiotherapeutic agents as well as surgery. Whereas stem cell therapy, chemotherapy, radiation therapy, target therapy, anti-helminthics can be used for the treatment of non-Hodgkin's type of. Okay, in case of clinical pharmacy, first unit we have already discussed that what are the roles of clinical pharmacies and responsibilities of clinical pharmacies. Here in case of medication review, award participation, drug utilization review, these are the three responsibilities of your clinical pharmacist. Medication review means the prescription given by prescriber has to be checked by this particular clinical pharmacist. First point, this is a prescription has given by the prescriber. That has to be checked by clinical pharmacist. We have to notice any interactions in that prescription, or else any advice to that particular patient we have to give. That we have to give by seeing medication review. Review is nothing but the studying of prescription again for this particular perfect prescription. For getting appropriate prescription, we have to go for this particular medication review. Medication review, in that prescription reading is one of the important, and we have to check the interactions which we may be noticed in case of that particular prescription, and advice to the patients, and we have to give how they have to utilize this particular medication, and dosing, how they have to take, how many times they have to take. All this will be comes under medication review. And then we have to take again, if the patient is came to us, we have to ask the previous prescription as a previous medication how they are taking, whether they are taking normally, they are taking appropriately or not. Inappropriate use may cause the adverse reactions. For that we have to review that medications. First of all, we have to go for the prescription of the patient, and then we have to give the proper guidance for that particular utilization, and then go for that particular again we have to check that particular prescription again if the particular person is came to our pharmacy. For these are the responsible, these are nothing but the medication review points. Review means we have to check the medications which are prescribed by the prescriber, as well as interaction checking, that will be initially we can perform. After that we have again the person patient, we have to go for the patient and we have to analyze, we have to inquire that particular patient whether that particular patient is taking the medication in an appropriate manner or not, appropriate doses they are taking or not. If they are not taking, we have to advise to take this particular dose. If they are not if they are taking regularly, there is no problem. If they are not taking, they will have to advise and we have to give the what are the effects they can be faced this particular condition if they are not taking medication properly, appropriately or irregularly. That is the main purpose of medication review. Medication review is nothing but the again checking of the medication taken by the patient as well as checking of prescription. This is nothing but the reading of prescription as well as checking of that particular or utilizing of that particular medication. And the second one is ward round participation. Ward round participation means this particular clinical pharmacist. In case of pharmacist, there are two types. We know that hospital pharmacist as well as or clinical pharmacist. Clinical pharmacist has to mingle with the therapeutic the treatment team. Hospital pharmacist, that particular may should dispense the drugs, compounding and dispensing. In this condition, clinical pharmacist has to go each and every ward, and they have to check whether this particular therapeutic goal is achieving or not. Ward round participation is nothing but the going of each and every ward of the particular hospital. Hospital will consist of so many wards: general medicine ward, general medicine male, general medicine female, orthopedic, gynec. What are these are the wards. This particular pharmacist, clinical pharmacist has to be go through and they have to take care of this particular drugs, how that particular patient is taking or not. In case of wards, that is called as ward round participation. Overall review, that is called as medication review. For a particular ward is called as ward round participation. Each and every day one pharmacist has to go for one ward or two wards, and they have to check whether that particular drugs are going properly or that there is an achievement of therapeutic goal or not. That has to be checked by in case of ward round participation. And drug utilization review. Utilization review is nothing but whether this particular using of drugs is proper or not. Utilization, if a patient is utilizing this particular drug appropriately or not, that we have to see. In case of majorly we can go for the drug abuse like narcotic drugs. That particular drugs utilization may causes the improper or inappropriate utilization of that particular drugs and may causes this particular unwanted effects. So we have to utilization review how they are utilizing. If in case of patient concern, we can go for the whether the patient is properly taking or not. Whereas in case of hospital concern or the clinic concern, how many drugs they are getting, how they are utilizing, whether they are utilizing properly or not. Hospital structure means how they are getting indent, how they are utilizing means whether they are prescribing for this particular patients, how it will be utilizing. That is nothing but a drug utilization review. In case of patient concern, patient properly using or not, or irrespective they are using or unwanted they are using or wanted they are taking, that we have to analyze in case of drug utilization review. These three we can come across: medication review, ward round participation, as well as drug utilization review. These will become in case of your fifth unit. That we already discussed in case of first unit of clinical pharmacy. What are the roles of clinical pharmacist as well as responsibilities of clinical pharmacist? Thank you.